Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
A couple of decades ago, we thought about Alzheimer's disease as sort of the end stage part of that disease.
Dr. Ron Peterson is director of the Mayo Clinic Alzheimer's Research Center and on a mission to unravel the mysteries of this dreaded disease. With the help of volunteers, his staff has learned a combination of genetics and environmental factors seem to play a role. Also, that complex changes in the brain begin a decade or two before symptoms ever appear. That's allowing doctors to diagnose Alzheimer's and intervene earlier than ever before.
We have imaging modalities, we have what are called biomarkers, so blood tests, spinal fluid tests, that give us a clue as to what's going on in the brain.
Dr. Peterson says the biological hallmarks of Alzheimer's are called plaques and tangles, proteins that are deposited in the brain, eventually leading to the failure of nearby nerve cells.
But usually that process begins in the memory part of the brain, so-called temporal lobe or around the hippocampus in the brain.
High-tech imaging allows them to monitor not only changes to the physical structure, but also to chemical functions within the brain. Peterson says that's all well and good scientifically.
But we're hopeful that, in fact, as the field moves forward, we will be able to develop therapies, drugs, immunization therapies that may, in fact, have an impact on this underlying disease process.
In the meantime, Dr. Peterson says each of us may be able to prevent or delay the onset of Alzheimer's. Research shows a heart-healthy diet and engaging in regular physical, intellectual, and social activities all reduce our risk.
Aging need not be a passive process, such that we just sit there and watch it happen.
For the Mayo Clinic News Network, I'm Dennis Doda.
My mom and I are very close.
So whenever they can, Emily Ruby and her mom Karen Sansom hit the local shops to enjoy a hobby they've shared for years.
We'll shop a lot together, and it's one of our favorite activities.
They also share something else, a gene that runs in their family that dramatically increases their risk of developing colon and some other types of cancer.
I knew that there was a history of colon cancer in our family.
On Karen's father's side,
we could trace it back to his mother, his sister, his grandmother.
Karen is also a survivor, and so is 24-year-old Emily, who was diagnosed with colon cancer at age 19.
It kind of aged me quickly almost.
At some level, I was prepared for it maybe later in her life, but at the age of 19, it was completely devastating.
The condition is called hereditary non-polyposis colorectal cancer, or Lynch syndrome.
It's a form of hereditary colorectal cancer, and it runs in families, and they're at risk not only of colon cancer, but a variety of other cancers.
Dr. Amy Oxentenko says if you have Lynch syndrome, there's a 50-50 chance you'll pass it on to your children. Genetic testing can verify if you're a carrier.
If you find out you have it based on your family history or any kind of testing, you need to begin a very vigorous screening and surveillance program.
The program includes colonoscopies starting at age 20 or younger, depending on your family history, upper endoscopies to check for stomach and small bowel cancers, plus early and regular screening for gynecologic and kidney cancer. The goal is to catch precancerous or cancerous lesions early while they're still curable.
The most important thing to do is educate yourself, first of all.
Emily and Karen are both doing very well. In fact, the visit to this flower shop marks a very special anniversary. It's been 5 years since Emily's diagnosis, and she is now cancer-free.
It's a big day to celebrate, and I'm very happy about it.
For Mayo Clinic News Network, I'm Vivian Williams.
Shoe shopping for kids. The choices seem endless. Racks and rows of styles, materials, and options. Dress shoes, play shoes, athletic shoes. And once you find the perfect pair, parents know it's probably time to do it again.
Yeah, they just grow right out of them.
Sarah Sock is a mother of two, including 5-year-old Dora. She hopes she's going about it the right way.
Mostly getting the right size for their feet so their toes aren't smushing.
This one I wasn't as fond of because it has a really thick sole and it's very hard and rigid.
Dr. Noelle Larson is a pediatric orthopedic surgeon at Mayo Clinic. She says the basic goal of kid shoes is simply to protect the foot from trauma in the environment. Beyond that, it's important to do no harm.
Particularly in smaller children, to pick a very wide shoe with a wide toe box so the toes aren't being crowded in the front of the foot, and also to pick a nice flexible sole instead of a hard sole.
Dr. Larson says research indicates at any given time nearly a third of children may be wearing shoes that are too small because they've outgrown them.
So I'd say it's better to change the shoes more frequently rather than necessarily investing in a very fancy, expensive pair of shoes.
If your child's feet seem not to have arches, not to worry. Dr. Larson says up to 20% of kids never will. The rest develop arches by the age of 10 or 12. Back to that do no harm objective. Parental guidance is suggested for teenagers who love high heels. Dr. Larson says girls need to be girls, but ankle sprains, bunions, and toe deformities could be the price to pay.
That's one reason not to wear them on a daily basis. Puts a lot of pressure on the ball of the foot, and as you can see, not very many people have a triangular shaped foot.
Sarah has a few years before she has to have that debate with Dora. In the meantime, every few months, there's a stop at the shoe store for a new measurement.
And pretty much every time, got to get a new pair. So
For the Mayo Clinic News Network, I'm Dennis Doda.
Aspirin. It lines the shelves of many pharmacies.
If you're a man over 45, a woman over 55, then you should probably be on aspirin unless you have bleeding problems.
Mayo Clinic cardiologist Dr. Stephen Kopetsky says a daily dose of 81 milligrams of aspirin, one baby aspirin, reduces the risk of heart attack for men and stroke for women.
Well, aspirin affects platelets.
Platelets are the components in blood responsible for clotting. If a tear happens in your coronary arteries, platelets help stop bleeding. But if the clot gets too large, it can block blood flow and cause a heart attack, or a stroke if it happens in your brain. Aspirin inhibits platelets from forming clots. Dr. Kopetsky says you can take any make of aspirin you want, but pay attention if you're taking coated aspirin, the type that's easier on your stomach.
And there were some recent reports that coating inhibits the absorption and that isn't as good for you. And that was only true if it's an acute heart attack. So the coating does delay somewhat the absorption of the aspirin, but if you're taking aspirin every day, it's fine. You can take the coated.
But if you're having chest pain, a heart attack, consider taking uncoated aspirin and up the dosage to 4 baby aspirins or 1 adult aspirin and chew it so it gets into your bloodstream faster. And call 911.
If you chew the aspirin, it will work on your platelets within about 45 minutes or start to block the clotting and start to lower your chance of dying if you're having a heart attack. If you swallow it, go into your stomach, it takes 2 or 3 hours. So for daily use, swallowing is fine. If it's acute, urgent use, it's better to chew it.
For Mayo Clinic News Network, I'm Vivian Williams.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.